Welcome to the show, Your Healthcare. I'm your host, Dr. Lahav. In this show, we discuss medical-related aspects and issues, and we interview everyone from the professional to the patient and everything in between. This is January 2015, and I'd like to start on the right foot. So today's show will be discussing your feet. What can we do about it? Some of the things that can cause foot problems. Today with us we have Dr. Patel, specializing in foot and foot surgery, and we'll discuss some of the more common aspects of the foot that can be bothersome to you and some of the simple things we can do in order to fix it, all the way down to the more complex issues. From flat foot to club foot, I'm Dr. Lahav. Stay tuned and we'll be right back to speak about your feet. I'm Dr. Lahav, and welcome to Your Healthcare. We're going to start to talk about feet. Everybody's heard these boots are made for walking. Well, they don't walk anywhere without your feet. Why don't we go a little history on the foot? If we can go to the PowerPoint presentation, please. We're going to talk about your foot. It's a complex structure. It's the foundation of your body. There's many small bones of the foot which are important for mobilization, maintaining your arch, and activity that you do based on the interaction of these bones within the foot. There's the forefoot, the midfoot, and the hindfoot. And different problems really arise in different parts of the foot. Many tendons cross into the foot, and a lot of the functionality of the foot is from tendons that actually originate outside of the foot, in your lower leg, giving that function to the foot itself to move your toes, to maintain some of the arch. And there's other small little muscles within the foot as well, but the bones are really held together by ligamentous structures or capsular structures, which helps a little bit more of the flexibility as well as the rigidity of the foot and to maintain that dynamic ability of the foot to do many things. There are little nerves that go into the foot, which are important really for sensation, proprioception, which is very important in balance. And we're going to touch a little bit with Dr. Patel regarding some proprioception and balance for even the older individuals, which helps a lot of times to prevent falls. Ligaments of the ankle and the foot. Most of the ankle injuries arise from the ligaments both on the inside and outside, called the lateral ligaments as well as the medial ligaments. But there's also ligaments within the foot that can be strained and can cause injuries, especially with different type of trauma. Fractures is something we'll touch about, and I'll bring around some of the more common type of fractures like the fifth metatarsal fractures or denser fractures. Depending on some of the activities or athletes, what can happen to the foot and how you stress that bone, which can cause fractures. And even within the same bone, there are different fractures that can occur which are treated differently. You may have heard of something called a Jones fracture, which actually is in the fifth metatarsal, and so the outside part of your foot is illustrated here. And really a Jones fracture is something that we have to treat very seriously with non-weight bearing and casting, as opposed to if the fracture is more proximal or distal, meaning closer in the bone or further in the bone. And again, the fractures there can dictate if you can put the weight on it or not. Some of these pictures here illustrate again the different type of fractures that can occur even in the fifth metatarsal, the small bone on the outside part of the foot. And each one of these fractures can be dealt with differently. The treatment is different. Calcaneus fractures. We see this a lot during the holidays where individuals climb up to the roof, putting the holiday lights on, missing the ladder or sliding off the roof, and you're laying essentially on your heel, called calcaneus fracture or heel fractures. These fractures can be very significant. They can really look sort of benign as the upper left picture there, but can be significantly an injury to the calcaneus or to the heel bone, which can really affect the remainder of your life if it's not addressed properly. This is just an illustration of surgery for the heel bone, where you actually have to open it up and put some plates and screws to bring it really back to its more normal or anatomic position in order to help prevent problems later on in life. So these are very serious type of fractures. Sometimes it's too comminuted or it's in too many pieces that we really can't piece it together, and we have to essentially put what we call an external fixator on your foot in order to distract the fracture and try to get alignment with little wires that go through the foot and through the ankle in order to try to get the best reduction that we can and the closer to an anatomic position as we can. This is what we see more in higher level trauma centers with higher impact injuries. What about more of the common issues with the foot? Things like bunion, what we call hallux valgus. Not all bunions need surgical treatment, but it is an option if conservative management has failed. And we'll speak with Dr. Patel as well regarding some of the treatment that can be done for this, not just cosmetic, but also for functionality and for pain. Hammer toes, corns and calluses, these are some of the things that we all run into one way or another. Different shoe wear, especially for women with sort of pointed shoes and boots, which kind of crowd those toes together, is not really what's made specifically for the foot. They look nice, they look great, and some of them can be very sexy, but unfortunately, it can injure your foot down the line and cause these different problems, which can lead to issues and thereby treatment by a foot specialist. Ingrown toenails, we've seen these before, a different type of infections that can occur around the nail fold, nail injuries. And these infections really should be taken seriously, especially in diabetics or any type of trauma, because literally the bone is just underneath the nail. It's very superficial. Different fungal infections in the foot, and especially in the toes that we see, everywhere from athlete foot to really serious fungal infections, have to be treated. You know, a lot of us walk around mostly, especially in the Northeast, with shoes all the time. We don't have flip-flops and walk barefoot. So the moisture from sweating in the foot and in the toes can sometimes lead to these problems. And foot hygiene is also very important, which we will speak with Dr. Patel as well regarding proper foot hygiene. And again, especially for diabetics or people who don't really have good sensation in the foot, they may not feel some of these problems arising, and at times you notice it a little bit on the later side. Plantar fasciitis, essentially it's discomfort in the bottom part of the foot, in your arch area, which we'll also discuss different ways we can approach this. And a lot of times this is treated conservatively with things that you can do, but there are other modalities that can also be used in ultrasound as well. And we'll discuss this with Dr. Patel. Flat feet. Flat feet in of itself does not mean that you need something surgically done or something major done, but it can cause problems, and it can actually change your alignment of your legs, which can lead to other problems like knee problems and hip problems. But it really arises from your foot. And we'll discuss some of the different type of arches and orthotics that can be used in order to help maintain a more anatomic or normal position of your arch. Here again showing flat feet on the upper left side, showing a normal on the left and an abnormal on the right. You can kind of see how it sort of turns in where the arch drops down. There's essentially no arch at all, and it changed really the alignment of your ankle, which can affect really the way you're walking, which ultimately can cause problems even up your leg. But it's really beginning at the foundation, which is your foot. What about warts? Different individuals in colleges, in swim meets, pools, saunas, walking barefoot, any type of injury you had to the foot before, cracks in the skin can essentially lead to warts. And a lot of times you really don't notice it. You may take a shower and just kind of take a feel. All of a sudden something feels a little bit hard or bumpy. And it can be very small, but it can actually grow to a very large size, which needs a more aggressive treatment. And this is some of the more common things that we see, but we have to pay attention to it because it is a problem and it can worsen with time if not addressed. So we'll discuss on some of the foot services that can be really given by a foot specialist like Dr. Sanjay Patel. And we'll return right to Dr. Patel. And Dr. Patel, thank you very much for being with us here.
You're welcome. Thank you for having me.
You know, I like to kind of think, again, the foot is more of the foundation. It can affect really how you walk, how you run, how you do certain activities. And I see as an orthopedic surgeon, you know, individuals that come in with knee pain and sometimes hip pain, and it's really not originating there. It's originating the way they walk. Their gait is different. Their stance is different. And you really kind of start looking down the line, down to the foot, and you realize that's where the problem really originates. So what do you generally see, you know, as people come to you for, let's say, kind of the more common, let's say, foot problems?
You know, variety of foot problems are seen from, like you described, from children having things like ingrown nails to warts, to flat feet, to having heel pain due to activity levels or different things they do. They play hockey and they're in skates and they sweat a lot. They're a dancer, they're on toes a lot, so they get ingrown nails, they get calluses, they get fractures, like you said, injury-wise. To adults who have flat feet, their foundation is off. When you have flat feet, you are turning your foot in a certain way and you're putting pressures in areas where you do not normally put. So your knee can wear down on one side, like you always see. And we see things like genuvalgia, which means that your knees are turned a certain way or your leg bones are turned a certain way. And it affects your hips as well. And it can also affect your back as well. You know, I have lots of patients that come from chiropractors saying, well, we're trying to fix the backs, but there's a problem with the foot. So, you know, can you address the foot? So the feet are the foundation for you. If the feet are not working right, nothing else above is going to work great.
And you also mentioned between kids and adults. And I think really for kids, because they're still growing, there are growth plates in your foot, which that's how your foot gets sort of bigger and longer. And some of those problems are actually different than the adult version, where adults can get tendinitis and ligament sprains. For kids, it's actually more of a traction injury, where the tendon is stronger than the bone and it pulls really on the growth plate, which is treated sometimes differently than adults.
Yes, it's very true. I see a lot of cases of something called calcaneal apophysitis, which is a very common occurrence when there's pain near the heel area on an active individual, male or female. And as you said, the tendon is pulling on the bone much faster than the bone can grow itself to accommodate that. So you have to figure out a way how you can brace that, how you can reduce the pain there by icing, by stretching, maybe by a proper support mechanism or orthotic. Maybe rest might be necessary sometime, although it's difficult when a child wants to be active and get going. So we have to consider all these things versus an adult where we may consider injections and things, but we do not want to do that to younger individuals.
Yeah, and I agree. And really for younger individuals, you know, these kids who usually start complaining of pain and that's persistent, that's something that I think we need to look into. And things like calcaneal apophysitis, which is traction of your heel cord on your heel bone, is something that I see also in soccer and football and in young individuals. And sometimes we do have to take them out of the sport for a period of time, let it come down. Then they can go back doing whatever they want. But it just allows a chance for kind of that bone to catch up with the tendon strength. And the stretching is the most important. A lot of kids can just run out there and play. But you really have to do the stretching, especially when you play quite often.
That's one of the things is about educating the younger individual and the parents as well, because the parents are also gung-ho. So you have to kind of balance that off. and you watch the kids and the parents, and you look at the parents' feet and the children's feet, and they're often very similar. You know, everything is genetics. You know, we have to choose our parents correctly, so to speak, if we can. So if I see a problem in the adult, that's the same problem usually starts in the child, but maybe we can avoid it by getting them into the right shoes. Make sure they're not wearing those thin sport shoes, or maybe lightweight sneakers. You know, wear proper shoes that will put their foot in a better position so they will not injure them.
Well, actually, that's a very important point, and I want to spend a little bit of time on that, because even for my son, we went out to buy new sneakers, and he says, you know, all the kids in his class, you know, they're 10, 11-year-old, they have all these cool new neon sneakers. And I said, well, you know, they're comfortable, what they do. Well, say, you know, they wear them to school, but when gym class comes, they change to other sneakers. I said, well, they're wearing sneakers, why are they changing to other sneakers? Well, they're not that comfortable for running. Well, they're not that comfortable for running, how good are they really as a sneaker? And I actually went to the store and kind of take a look at some of these. You see a wall of all of these neon bright, cool looking shoes and sneakers, and you take a feel. First of all, a lot of them don't have arch support at all, don't have really support for your foot. Some of them are made of plastic to harder. The shape is different, and they're completely uncomfortable. So you have to kind of weigh that coolness of the shoe versus really the comfort of the shoe. Mm-hmm. And we'll talk also about, you know, women's shoes compared to men's shoes, because even in the office for me, you know, I wear something that sort of have a bigger toe box that I'm comfortable. I can walk in all day long. I wear nice looking dress shoes. Yeah, I can sit around in the chair and it doesn't bother me, but if I'm walking on it the whole day, it does bother me. So I need that support. And I see a lot of women that come in, they have some ankle or foot discomfort, and they have sort of the stylish boots, you know, the pointed toes, the high heels. And really, as a human being, the foot is not made to sit on a heel that's, you know, 3-4 inches high, and toes that essentially give you essentially an inch or two in the front, but your foot really spreads to 2.5 inches. So it doesn't fit. It's trying to put almost like a square peg into a round hole.
It's so common. You know, shoes are a big problem, and we're the experts on shoes, so to speak. And I have 2 boys, and they both realized as they got older that, Dad, you know, can you get me some shoes that are not the cool looking ones, because their foot bothers them, or their heel bothers them, or something bothers them. You need shoes that are structured well. You need what's called a really good heel counter, stiff heel counter, good midsole, and plenty of room in the front. And if you can find those kind of shoes, those are the better shoes for you. Not the ones that are fad, not the ones that are going to tone your butt or something, not the ones that are ultra thin weight or something, or minimizers. Those are all gimmicky things. Those are things for these companies to make a lot of money on, because they're shiny and they're bright and there's something different. You stick to good old-fashioned good shoes. You know, my preference is good running shoes are the best shoes. If they're good for runners, they're good for people like me who do not run. So, you know, whether it's male, men or women, that usually works out well. And, you know, we tend to educate patients on what kind of shoes to look for, what brands they can look for, what type. You can get cool shoes for a small amount of time, but you just cannot use them for everyday life and everyday purpose and every activity that you do.
So if you're, let's say, a kid or a young adult, and you are looking for sneakers, just go again. What should you look for? Maybe for the audience to even know, is you go to the shoe store and there's hundreds of shoes that are out there. What do you look for in a shoe, in a sneaker? Let's begin.
If you look at a sneaker, my particular, some of the brands that everybody uses are like New Balance and Asics and things like that, which are fine. They have what's called a real good heel counter. So you want the back of the heel to be nice and stiff, not soft. If that is soft, and if your foot rolls in or pronates or flattens out, the shoe is going to conform to your foot, so it will flatten out as well. So you want something that's going to hold your heel intact. So you want a stiff heel counter, it's called. You want a good midsole to support your foot so it doesn't collapse, so it has some arch structure. You want materials that are breathable, that are better for you, so avoid things like sweating and athlete's foot and warts and fungus like you were talking about before. And you want plenty of room in the front. You should be able to wiggle your toes up and down. You should be able to press in the front and not press directly on the big toe, and still stick a pinky in the back of the heel at the same time. That's a good fit shoe. You should always get shoes later on in the day. Always try them when you're standing up, not sitting down, because we don't walk in our shoes sitting down. We walk in our shoes standing up. So those are some of the hints that I give my patient.
And what I used to do when I was even training for the foot, we used to take your chart, and as you were sitting, we used to trace your foot. And then we said, why don't you stand up now? And as you stand up, you can actually see the foot spread out. We draw another and say, this is really the size that you need, not the size when you sit.
And one of the most common things I do is we tend to measure everybody's feet, because more often than not, and adults are the most culprits. We all like to be the same waist size we were when we were 18, but shoe size increases as well, besides the waist size. So, we can't keep wearing the same size 9 shoes that we wore 25 years ago, because you're probably about 10 or 10 and a half by now. So we keep squeezing our feet into shoes that do not fit well, and you have all kinds of problems, including rubbing and blisters and nerve pain and pinching of nerves and tendinitis and et cetera, et cetera.
And what about, let's say, the female shoes? Because obviously for one pair of my shoes, my wife can have 10. And they're very nice and different styles and stuff. I kind of just go with black, brown, or sneaker. Done.
That's, what's a woman to do but buy more shoes, right? It's their prerogative. But women's shoes are, society is such that their shoes are narrower, they're more stylish, they're sexier, as you said before in your introduction. They crowd the toes, they're crunching them. So no wonder that 75% of our patients are all women. They have all kinds of problems, but they have to wear the shoes that they have to wear to please them, which I understand. So we try to educate them, and at times wear shoes that are better for you. Wear shoes that have more room. Maybe not when you're going to a certain function or place. You can be stylish, but you just can't. If you do it all the time, you will pay a price for it. And there are good shoes out there. They're just not worn all the time by most of the women.
What about heel? Is there a certain, let's say, heel height that you would say that's a little bit too much, or really is going to stress your foot a lot?
I think if you get above a couple of inches on heels, it puts a lot of forces in the front of your foot. The forces under your metatarsal bones are tremendous when you go up to 3, 4, or higher inches in heels. Also, if you have a heel that's very narrow, it causes instability in your back of the foot. So your heel's actually going back and forth. There's a lot of motion there. There's problems with the Achilles, the calf, your hips and knees, and your back pay a price for all that stuff. So I recommend, shorter heels and a fatter heel, or platform heels that stabilize your foot a little bit better. If you're going to pay a price in the front of your foot, at least stabilize the back of your foot, so you kind of give back a little bit.
And since we're talking about, let's say, shoe wear, which again, it's the most kind of common types of issues that we see, which can lead to problem in the foot. Let's talk a little bit about orthotics, because I see that also people come in and say they spend $400, $500, $600 on orthotics, and they got 2 pairs, and it's over $1,000 already, and it didn't help them. And now they're coming in and say, I spent all this money, I still have a problem, my foot still bothers me. And there's a difference between, let's say, a foot specialist doing it versus you go into any store and you kind of get something that's made for you based on some technicality that occurs, or something off the shelf, for instance. So being a foot specialist as yourself, how do you determine, let's say, different types of orthotics? Who needs them? What type of orthotics are there? What do they go for?
There's a wide range of things with orthotics. Now, everybody does orthotics or insoles or inlays, from Walmart to grocery stores and to shoe stores. Not everybody needs orthotic. It's like saying everybody needs glasses. Not everybody needs glasses. Some people can actually see without glasses. And if you function fine in your feet and you have a good foot structure, you do not need orthotics. You need orthotics when you have something called faulty mechanics. So if you take a model of the foot per se, and if you have a good arch, a decent arch, and you have a good foundation on top of that, and you wear good shoes, you do not need orthotics. But if your arch collapses, let's say it collapses all the way down like this, and your knees turn, you may need an orthotic to support it. So if you take an orthotic, that holds your arch up, that holds your heel in a cup formation.
Yeah, turn it actually even a little bit more this way so you can, there we go. So it can
So
be seen in the
in this
camera.
position, so your foot doesn't turn in. So there's less stress on the inside of your foot and your ankle. So the tendons are not being overused and injured. There's less stress in the knee above as well. And so the forces are balanced. Orthotic is about balancing your foot under the rest of your skeletal system. So there is less trauma or damage occurring to the joints, the ligaments, the tendons. Not everybody needs orthotics though. You know, most orthotics that are made outside, they're called, they're accommodative orthotic. They're basically glorified insoles. You use a computer scan which kind of tells you how much insole to put in there, and then you pay all this big money for it. Proper orthotic, somebody who has a biomechanical exam of the foot to figure out how much range of motion you have, what can you tolerate in your foot, and if it's going to fit into your shoe or not, what kind of shoes you wear, what kind of, have the patient walk back and forth. So there are two kinds of orthotic. There's accommodative orthotic and a functional orthotic. An accommodative orthotic is usually done more for patients who are elderly, who have lesions on the bottom of the foot. So you accommodate those lesions, meaning you pad around them so they're cushioned, and they're taken from a mold of a foot. A functional orthotic, like the one I'm showing you, this is my orthotic. I wear this. The reason I wear this is because my foot rolls in the ground too much and I have some pain on the side of my knee. When I wear these, my foot is balanced under the knee. I do not have my pain as much. So this functions to put my foot in a better position under my torso. So I feel better and I function much better. And that's the difference. The functional orthotic are usually a little bit stiffer. They're taken from a mold of your foot, whether it's a casting mold or a foam mold, but it's done by a professional where you put your foot in a certain range of motion by putting a joint under your ankle called your subtalar joint, which is this joint under here, on the bottom of the foot, on the bottom of the ankle. And that joint has to be in a certain position for you to make the proper cast mold of the orthotic. And that's what allows you to make the right functional orthotic.
And that's actually a very, very important point between those different type of orthotics, because in some places where you go to and they do put you in these sort of electronic thing that says, well, your foot should be here, we'll make your mold, or the orthotic really, to make your foot to that position. Normalcy is sort of an average. Not everybody is exactly the same. And sometimes when you try to correct a foot to what's considered normal, it's actually not normal for you. And by putting that orthotic, it actually causes more pain in the foot because it puts pressure in areas that really you're not supposed to have. And that causes really, I think, a problem. And you get this orthotic, which you come in now, it says, my feet are killing me. They were uncomfortable before, but now it hurts a lot. So this sort of normal appearance of the foot that they're trying to really reestablish is not normal for that person. It's normal for the average individual, where when somebody comes, let's say for you, you do take a look at the dynamics of the foot, the arch, the functionality of the foot, the mobilization, and you devise something that says, well, we're going to do it this way because it fits your anatomy. It's essentially, tailored to you, to your problem and to your foot.
Correct. Not as I said, not everybody needs an orthotic, but the ones who do, and I would say maybe 10% of the patients coming to my office may need an orthotic, but 90% may not. So it's not like you go into a shoe store and 100% of patients need orthotic. That it's a sell for them. I understand it's a business, but as a doctor, as a professional, my job is to put their foot in a better position so they have less pain and they can do the things that they want to do, and that's more important.
Right, and sometimes they do use something off the counter first before I say, look, we're going to try something simple. If not, we can definitely move on.
Our approach is always that way, and I have what's called these prefab orthotics that are professional grade. They last for a while. So I tell them, try this for a while. It doesn't cost much. Try it for 6 months or 3 months. If it helps you somewhat, then we can go on to something more expensive, and they can last for years.
All right, that's very important. So we've been talking with Dr. Sanjay Patel, foot specialist, about your foot. I'm Dr. Amit Lahav. Stay tuned. We'll be right back to continue speaking about your feet. Welcome back to the show, Your Healthcare. I'm Dr. Amit Lahav, and today we're speaking with Dr. Sanjay Patel about your foot. I'd like to move on to a little bit of the more common occurrences, things like wart, fungus, maybe hammer toes, corns, things like that. We first talk about differentiating things between, wart, calluses, corns, just by definition. What does that mean?
Calluses and corns are quite common, and they're essentially extra skin or hard skin that grows in areas of pressure. Calluses are typically on the bottom or the side of the foot, and corns are typically on the top of the toes or on the side of the toes. Corns are a little more concentrated and smaller. Calluses are usually wider and thicker. Warts are a different animal. Warts are viruses that infect your skin. You usually pick those up on a wet surface or a sauna or someplace or swim areas where somebody else has a virus or a wart and has walked before you. If your skin tends to be porous, it tends to be sweaty, or if you have a break in the skin or an injury, then you can pick up a wart. That virus can stay in your skin for a long time and you would not know it. It can take months for it to come out to the surface, and you feel a bump or a raise or a thickening or something unusual. And then eventually it can proliferate, it can grow and get bigger, and it can be more painful.
And fungus.
Fungus, again, it's a disease process that occurs as the mold, the spore mold of a fungus gets into either your skin or your nails. Very common for fungus to be occurring in your skin for a lot of people. We just do not know it. We don't understand that we have it because we have no symptoms from it. We do not have necessarily pain. We don't always have that burning and the fire you see in the commercials, but it's just kind of there. As we call it, subclinical. I notice it because I see little patterns on the skin, little red bumps or a little something between the toes, and that's a very mild tinea pedis is called, or fungus. If that's there long enough, eventually it can get into your nails and cause what's called onychomycosis, or those nails that look pretty cruddy looking. Believe it or not, the winter time is a lot of time when a lot of these things occur without us thinking about it. We do not notice these things in the winter because our feet are covered up. We notice it in the spring and summer when you look at it like, oh my God, what's going on down there? But this is the time of the year we wear extra socks or thick socks or wool socks. We wear insulated shoes. We go outside. And yes, it's cold outside, but it's not sub-zero all the time either. So your feet are quite warm and they get wet and sweaty. Then we come inside the house, we take off the shoes, but the socks are still on. It's still a nice, warm, humid environment for all those little critters to work on you. And it does proliferate in there and things get worse. And we see the results of that in the summertime. We see things like viruses or warts. We see fungus infections, whether it's in the skin or the nail, and then we take care of those down the line.
So if we kind of differentiate between having an infectious process like fungus, bacteria, warts, type of viruses, and really more of a pressure problem like corns and calluses. Let's talk about the corns and calluses first, because that may be an easier fix to change sort of the pressure on that area.
Majority of the time, simple corns and calluses are caused by small deformities in the foot. Whether you have a bunion that's protruding on the side, you're putting pressure there, whether you have toes that are buckled up and the shoe is rubbing on top of them, causing a corn there. So, you can shave the corns down or the calluses down, whether it's in our office setting, or you can do it at home, or you can put medicated pads on if you're not a diabetic, because you have to be safe about those. That's one way of trying to take care of what you already have on your skin. The other thing you need to also do is figure out why do you have the pressure there. If the shoe is too tight or is too narrow, you need to get shoes with a little more room in the toe box, maybe a little bit of a wider shoe, maybe have a little extra cushion in your shoe to support the area. Maybe if your foot rolls in too much and one side of the foot gets a large callus that blisters or is painful or gets infected, well, maybe then you do need one of those orthotics to hold your foot up properly. And that's why you come in the office for something like that.
So that's really where you have to change maybe your shoe wear or the pressure points. And that can make the difference to not have these things occur again. And then shifting over now to those infectious component. You know, a lot of these sort of foot infections, like the fungus and the viruses, can take a very long time to come around rather than the bacterial infection around, let's say, the nail fold, which can become acute very quickly. And that's a more acute situation. We have to treat it. But if you talk about kind of the slower growing things like warts and fungus and even, you know, fungus infection to the nails, you know, some of the treatment for that can be for a long duration.
I'll talk about the fungus part first. The fungus is a slow organism that grows and it festers. So the slowness of it makes it more difficult to treat and eradicate. So there's two main components to treating a fungus infection. First, you try to reduce the fungus that's in the skin or the nail, whether it's by topical medication, if you're a candidate for oral medication, sometimes you need to have laser treatment on it or a combination of treatments. Skin fungus usually we can get rid of by topical medications as well. The second component of that is, why do you get this? Is it because of the shoes you're wearing? Are they not breathable? Are you wearing socks that are not conducive to what your skin type is? If your skin is sweating a lot, maybe you need to wear socks that are more breathable or synthetic socks. You know, the Under Armour is a billion-dollar company because of that, because they make moisture wicking away material. But they have socks for these things. They're synthetic socks. Contrary to what we learned in the past, you know, we do not want to wear cotton all the time. Cotton absorbs the moisture, but it keeps it there. So it acts as a cocoon for the moisture and heat. So you want to wear synthetic socks that breathe away moisture. You want to treat your shoes. Maybe you want to spray something in your shoes to kill anything that's in there. You know, if you put all the medicine in your foot, but you wear the same bedroom slippers for 2 years and they haven't been washed, well, what good does that do? You know, that doesn't do any good. So you have to treat your environment as well as your feet to eradicate the problem so it doesn't reoccur as well.
And so that's, you know, for the fungus. Things like warts, same thing. You look at the surfaces you walk on, check your feet, and obviously it takes some time to treat those as well.
The warts, because it's a virus and it hides under your skin, you have to treat the skin. The body is going to wall that area off and create a callus, and it'll become thicker, painful, it can spread. So when you come see us, we want to shave the dead skin down to reduce, so we can effectively treat the virus. We can put topical medications on, various ranges of topical medications, some mild, some strong, depending on how deep it is, how long it's been there, how much the patient can handle, because sometimes they can be a little bit uncomfortable. We can freeze them, we can put other medications on them, we can do topical medications at home, we can even inject them if they're really chronic warts that do not go away with some esoteric ways of treating them. But they can be gotten rid of. The other part of that, again, is the same as the virus, same as the fungus. Make sure your skin is not sweating too much. You maybe have to use a drying agent around the virus so the virus will leave your skin quicker. Maybe you have to make sure that you're not on wet surfaces. Make sure you wear flip-flops when you're in, you know, freshman dorm in college, so you're not going to spread them to other people or get them yourself. If you have other siblings at home, you come out, you use a same bathtub or shower stall. Make sure you wipe that down after the shower, so you're not spreading it to other kids. So you want to educate everything, all the family members, is not to spread this and reduce the infection rate to other people as well.
And I think this is actually maybe a good segue to just talk a little bit about the diabetic foot, because they can see these things occur and they may not even feel anything for a very long duration before it's actually pretty significant. You know, putting aside even, you know, gangrene and you know, toe amputation and things along those lines, but really just the infectious process or problems that can occur in, let's say, diabetic feet, because I'm sure you see your share of diabetic feet as well.
It's diabetic feet is a very complex problem. It happens so often, you know, and a minor blister to us, you and I, we'll feel it. We said, oh, you know, I have a blister, it's a little red or uncomfortable. We'll put a bandage on it. We won't wear our tight or fancy dress shoes. We'll wear something loose, and we'll keep an eye on it and we'll heal it. In a diabetic that has an insensate foot or neuropathy where they cannot feel what they're stepping on, can have a blister that can get infected very quickly because they have other problems with their immune system and healing problems and other things. Because they do not feel it, they can walk on their blister for 2, 3, 4 days or a week or 2 weeks. Next thing you know, there is an infection that occurs underneath there because the skin will break down. then infection goes deeper into the tendon area or into the bone, and that can be a major emergency, so to speak.
So for diabetics, really, even small problem of the foot can emerge as something worse, like osteomyelitis, infection of the bone, which can lead really essentially to holes in your feet, which you have to be sometimes debrided surgically in those cases. So really for diabetics, one of the number one things that I want to mention is you do have to inspect your feet, especially if your sensation is not normal, just to make sure there's no cracks or little redness or something that's abnormal that's occurring. In the very severe diabetics, where you really don't have much sensation at all, you can actually have your joints crumble down and deform completely without you feeling anything at all, something what we consider Charcot joint. And that's a really more serious condition, and that's really where you have more of a custom-made support for the foot, for the ankle, in order to really relieve pressure in different areas of the foot and allow it to heal for the individual.
The number one key thing for diabetics and their feet is all about prevention. They have to have regular care on a regular basis with a foot specialist at all times. I tell my diabetics, you get a pimple on your foot, you call my office and come in, because we don't know what that is. You may think it's nothing, it could be something major. You have to be in protective shoe gear all the time. Proper shoe gear that is made properly with plenty of room in it, with insoles that support your foot and accommodate pressure points, so you avoid ulcers and things like osteomyelitis and infection. Of course, controlling your sugar is the number one thing, but as far as the foot doctor goes, our job is to see the patient on a regular basis, to avoid infection, to detect problems before they occur. Make sure we tell them, oh, you have a callus under your big toe. If you walk barefoot without proper shoe gear, that callus is going to blister and it's going to get infected, and you may end up losing your foot possibly. You cannot sugarcoat this. This is serious stuff. So you have to protect them, you have to inspect them, you have to educate the patient about washing their feet regularly between your toes, keeping them clean, hydrating them properly, not going barefoot in areas where you do not know. That's the most important thing I tell my diabetics.
And I want to emphasize that for diabetics, it's a different animal. You have to really pay attention even to the small things, where the more normal individual without a diabetic problem, things can heal very quickly, but for the diabetic, really attention to detail is most important. I'm Dr. Lahav, speaking with Dr. Patel here about your foot and your feet. Stay tuned, we'll be right back to Your Healthcare. Welcome back to Your Healthcare. I'm Dr. Lahav, and we're talking with Dr. Sanjay Patel from Patel Podiatry about your feet. I'd like to actually go a little bit more into proprioception and balance. I think that's something that sometimes is overpassed regarding different problems with the feet and surgery, but I think it's actually most important, especially with the number of hip fractures that occur in the United States. Proprioception and balance is most important.
You know, we see a lot of elderly, obviously, because they have a lot of foot issues, whether it's corns or calluses or major things. And I see so often that so many patients have falls and they end up having surgeries, you know, by you or somebody else. They end up in facilities or nursing homes, unfortunately, and the health deteriorates. So, you know, I started looking into it, and I realized that the Western elderly tend to fall a little more often than elderlies in other parts of the world, especially the Eastern world. Now, part of it's us. You know, we're a sedentary population. We sit down, we watch football, and we eat, and we get bigger. And as we get bigger, we tend to lose our balance. As we get older, our balance will tend to deteriorate anyway. But if we're obese, our balance will be gone even faster. We cannot balance ourselves. We'll fall, we'll break parts in our body. As well as us not being a walking society, we lose some of the natural receptors we have in our body that hold ourselves up. Simple things I tell my patients is, besides walking, which I'm sure you tell all your patients, you know, walk. That's the best thing you can do, is walk. Anywhere, anytime, you just walk. I tell them to do simple toe raises exercises. You hold on to a ledge and just go on top of your toes and hold it there, 5 seconds, 10 seconds, then come down, then do it again. You can do as many of those as you can during the day. There is no limitation. Do them with your eyes closed if you feel comfortable. That's really balancing. If you train your muscles to balance yourself on the tip of your toes, then hopefully, as time goes, your balance mechanism will always be there when you get into your 60s and 70s and 80s, and you will not fall.
And I think actually that's most important, because that can save a trip to the emergency room, and also can save you from seeing me at the emergency setting, where you have to essentially fix it with some metal screws and plates and things like that.
The other thing I want to add is, of course, we talked about the diabetics before, and as you know, when they lose sensation, the fall rate increases even more. So it's so important that the diabetics have proper care, proper control of the sugar, and they have to exercise, not only to control their sugar, but to keep the balance as well. So they have a greater onus on them to do more than just control the sugar. Walk and control the sugar. It's walk and control the balance as well.
And you know, when I see patients in my office, sometimes they come in to say, let's say with their more elderly parents, for instance, they have, you know, certain falls. You know, every now and then I see them fall. You know, one of the first things I say is, let me see you walk. And one way to determine really how you're walking, patients who don't have sort of normal sensation in their feet, although they say, I do feel it, if they're really, the way they walk, they space out more. So your feet are not closer together. It's what we call kind of a more wider base. You're trying to kind of balance yourself more when your feet are further apart. Also, the way you're walking forward. Are you walking forward sort of little steps like this, or can you take a bigger stride? Because if you're not really feeling the ground as well, you're not really sure where that foot is going. And just by watching that in the individual can dictate where really the problem arises. Is a balance problem, proprioception. You know, do you have the sensation in your foot that you're not really feeling what's going on, and that's why your gait is changed? So something, even type of therapy can be helpful to teach you really to walk more normally. And I want to now just kind of go maybe a little bit, and for the sake of time, to let's say some of the more elective type of procedures that are done surgically by a foot specialist.
Some of the common things that I do are bunion surgeries, hammer toe surgeries, neuroma surgeries, removing bumps and lumps around your foot, excision of growths or cyst formations, heel spur surgeries, things like that. The main one that a lot of women come in for is bunions, of course, which is a protrusion of your big toe joint. A bunion is actually a dislocation of a joint. One toe is moving away, the big toe is moving away from the rest of the joint. And it is genetic in its nature. You're predisposed to it. So shoes can aggravate the bunion, but they will not cause the bunion. But if you wear a 6-inch heel, you'll notice the bunion a lot quicker than later on in life. Now, if a bunion causes you pain, causes you discomfort, you're unable to wear shoes, you're unable to do the things you want to do in life, that's when we consider surgery to fix it. And modern bunion surgery is fairly advanced. It's fairly simple. Patients heal great. They do not come back. And they can be fully functional in a few months after the surgery.
Can you go up and weight bear on it right away? You have to protect your weight bearing after surgery?
The weight bearing status depends on the size of the bunion and how much bone we have to move and fixate. Meaning, you know, just like you use plates and screws, we use little screws and things. So it depends how large the bunion is. It also depends on the patient as well, if they can weight bear or sometimes we use wedge shoes to just put weight on the back of the heel and not the front part of the heel. Not every bunion needs to have bone cut and moved and screw placed. Sometimes we can just shave the bone and realign the tendon possibly. So those can weight bear right away. So some bunions have to be can weight bear right away. Some you have to stay off of it for a few weeks till you can put weight on it again.
And the bunion is the big toe, but there's also something called a bunionette, which is actually really a bunion of your small toe.
Bunionette is a tailor's bunion, or the old tailors when they used to sit on the side of their foot. It's an enlargement of the side of the near the small toe, and it's like a mini bunion. We do the same procedure on that as the big toe joint to reduce the protrusion, the angulation of the bone, to kind of narrow it so you can wear shoes properly and be pain-free.
Let's talk about hammer toes, for instance. You know, simple kind of in and out of procedure.
Hammer toe is quite common as the toes buckle up. They cause redness and pain on the top, unable to wear shoes again, and chronic discomfort. What we do is we try to balance out the toe again. If the joint is arthritic, we have to shave a little bone from the joint, either relax the joint or fuse the joint, reposition the tendon so the toe is in a straighter position. The difficulties in hammer toes becomes is when you have a bunion where the big toe joint is going towards the smaller toes, and then you have overlapping of the toes. Those are more challenging procedures because it's hard to balance the toes in the position this one side to the other. It's easier to balance them from top to bottom. So the positional changes occur. So I tell patients when I see them, I said, if you want to correct this, there's a golden period, so to speak. This time is now, otherwise it's going to be difficult to correct them.
And you know, that's again some of the more common surgeries that you see that are elective basis. You also do a lot of different type of injections to the foot for different things like neuroma or nerve type pain, sometimes for arthritic type of pain that can occur from the joint itself. You know, we've spoken about some of the you know, orthotic balance, proprioception, and really foot care. We're going to take a short break, and we'll come right back to recap again about your foot. We're speaking with Dr. Sanjay Patel. Welcome back to Your Healthcare. I'm Dr. Lahav, and we're here with Dr. Sanjay Patel, foot specialist. Before we conclude today's show, I just want to mention one quick thing, if you don't mind, Dr. Patel, about maybe the shockwave therapy, something that you actually do also for foot and different type of tendinitis, for instance.
For patients with chronic heel pain, whether it's the pain on the bottom of the heel or the back of the heel where the Achilles tendon is, after you exhaust other treatment options, before you consider surgery, one of the things I recommend is a shockwave treatment, which is a non-invasive European technology, and it has great success in treating these kind of painful conditions, where 2 to 3 treatments will reduce the pain about 75 to 80% of the time on a permanent basis.
And that's something that can be done obviously by a foot specialist as well.
Yes.
So shockwave therapy, something out there, new technology. It's been around for a little while now, but can be very helpful. Today we spoke about your foot. Like I mentioned in the beginning, these boots were made for walking, but not with proper feet to make them walk. The foundation really to your ambulation, to your gait, to the way you walk, is really your feet. And I see a lot of problems in an orthopedic surgeon that above, but really the etiology, or it begins really at the foot. So proper foot care is very important. As a diabetic or someone who doesn't have good sensation in the feet, utmost important. Take a look at your foot. Evaluate your foot. Do walking. Make sure your foot is balanced. Have proper shoes. It's not always about coolness. It's about comfort. Make sure you do take a look at your feet. Keep them clean and evaluate. And if there's a problem, you can always go to a foot specialist just like Dr. Sanjay Patel. I'm Dr. Amit Lahav. This show is Your Healthcare, and make sure you take care of your feet.